Hi, I'm Dr. Antonia Altamari, and I'm one of the infectious disease physicians at Dartmouth Health. I'm also the co-medical director of the Ryan White HIV program and the program director of the New Hampshire branch of the AIDS Education and Training Center for New Hampshire. Today is World AIDS Day, and I'd like to give a few statistics and where we've been and where we are now with regards to the HIV epidemic. There are about 38 million people living with HIV in the world, and in 2021, there were 1.5 million new diagnoses made, which is a significant decrease in both diagnoses and AIDS-related deaths. Additionally, almost 81% of all pregnant women now have access to antiretroviral therapy, which has dramatically decreased the rate of transmission of HIV from mom to baby. In the United States, we have about 1.2 million people living with HIV, and there are about 30,000 new infections occurring annually, which is also a significant decrease over the last several years. About 70% of these new infections are occurring in men who have sex with men, and 70% occurring in Black, African American, Hispanic, and Latino people. Although we've come a long way with diagnosing HIV, about 13% of people don't know that they're infected with HIV. The National Strategic Plan for Ending the HIV Epidemic consists of 4 different pillars: early diagnosis, early treatment, prevention, and responding quickly to outbreaks. The 2030 goals are to decrease the number of new infections by 90%. The goal is to increase the number of people who know their status to 95%, and to increase the percentage of those who are on treatment and virologically suppressed to 95%. We have come a long way with the treatment and prevention of HIV, and in fact now have long-acting injectable medications both for the treatment and prevention of HIV. We know that treatment acts as prevention. If someone has an undetectable virus, they will be untransmittable to others. The risk of perinatal transmission, which is infection from mom to baby, has decreased to less than 1% with antiretroviral therapy given to both mom and baby. We also know that only about 25% of people at risk are being prescribed PrEP, or pre-exposure prophylaxis, and the national goal is to increase that percentage to 50% by 2025. Here at Dartmouth Health, our goal is to increase PrEP prescribing, that is pre-exposure prophylaxis prescribing, during the year of 2023, with the goal to end the HIV epidemic in New Hampshire. We have embarked on educational series for providers, marketing to consumers, new practice guidelines, and EDH or EPIC order sets for providers to use and know exactly what they should be giving and when to those at risk. With increased testing, diagnosis, treatment, and prevention, we can end the HIV epidemic together. For more information, please see the Center for Disease Control and Prevention website on HIV, and you can get more information from our DH link below.